Welcome to Ben TV. My name is Abdulrahman Kotomish, and everyone calls me Budi. I'd like to introduce my guest today. Welcome, Carlos Araya. How are you?
Good, thank you, buddy. How are you?
Let's start from the beginning. Tell me more about your journey moving here to Australia.
Well, I'm from Chile, and I lived in Ireland for a year. And when I went back to Chile, I wanted to keep traveling. And I saw this opportunity to come to Australia, and I moved here.
Why did you choose Melbourne especially?
Actually, I didn't want to live in Melbourne. I wanted to live in Sydney. I'm an engineer, so I had like this spreadsheet, and I had like all these scores and point system. And Sydney won by 1 point. And then when I was there, I was like, nah, I want to live in Melbourne. So I moved here a couple of weeks after, and I've been here since then.
You work as a peer navigator support in Living Positive Victoria. Would you want to tell me more about Living Positive Victoria and why did you start working there?
In 2020, during the lockdown, I was not working. I was sharing a studio with a friend. I was not getting any like financial support. So I was living from my savings. And while that was happening, I got diagnosed with HIV. And I saw it as an opportunity to test my resilience. And I did it. I took it as an opportunity to grow and do something meaningful. And because I wanted this like financial distress, I had a peer support, which is people that lives with HIV that help people that have been recently diagnosed to kind of navigate that. And my navigator got me like this gig. There was like a public talk, and I took it just out of necessity, like because I needed the money. But I was not in like I didn't want to post myself, share my story. I did have experience public speaking, but never about like my life. That went well, and I kept doing it. Then started like volunteering in workshops. Then that led me to like do different things like around migrants on a national level. Then I become a director at Living Positive Victoria. Like I was part of the multicultural working group. There is like a new thingy. And then last year I applied to this job and I become a peer support worker.
So you worked in so many areas in Living Positive Victoria. So currently you do the peer navigation. I also know that you do lots of the peer navigation in Spanish, and there's lots of Latin American clients. Tell me more about that.
When I started using the Living Positive Victoria services, it was all in English, and I felt privileged to have a good English level, so I could connect, communicate, and all that. But I knew people that were not comfortable disclosing their status, but also attending like things in English. And I started advocating because of that. Because it's also as a migrant, I don't have access to Medicare, I don't have a visa, so there are things that affect us. And it was not like a concern in the HIV sector before. Just by trying to change those things, when I landed into this job, I was the first peer navigator that was able to provide the service in another language. And it was not only that, but also the experience of understanding the challenges that we face as migrants that live with HIV. I think that I brought a lot to the
table.
That it was surprising that I got like too many clients. Like everyone was surprised at the engagement that we had. And I think it's because there was a need there that we didn't know existed.
When you got diagnosed with HIV, you were here in Melbourne. And was the medication accessible to you easily?
Kind of. When I got diagnosed, I remember that I was told that the only thing I need to worry about was my mental health because it was going to provide me the medication. And I asked, like, how's that possible? The cost it had, because I didn't have money at the time, so I was also worried about that. This was in 2020, and they told me there was a program called Compassionate Access, which meant that pharmaceutical companies provide for free medication to people that are not eligible for Medicare. But the way they told me, they say someone's gonna decide is if you can get the medication or not. So it was very stressing for me to know if I was going to get it or not. but also I didn't know how long these companies were going to do that for me. So it was very like scary to feel like vulnerable in that sense. But last year Australia changed the law,
Yes,
and now any person that lives with HIV in Australia, regarding their visa situation, they all have free access to medication.
that's great news. That's something that I heard about, and it was like very helpful for all migrants that they have access to HIV, and it's like I feel like as queer people have like HIV is always holds a lot of stigma
Mm.
and is a lot of trouble around it. So as a person living with HIV, what is the a misconception of people living with
Mm.
HIV?
There are a few. I mean, there's still a lot of stigma, and people still have a lot of wrong ideas about what it means to live with HIV. I don't know if people know this in their houses, but now HIV is a very manageable chronic disease. You only have to take one pill a day, and that's it. Now there's injections. I'm on injections, so it means that I get one injection every 2 months.
Can you
Uh,
explain more what happens when you take one pill a day?
yeah, so what the medication does, stops the virus from spreading inside your body.
Mm-hmm.
So the viral load, which is like the amount of copies of the virus in your blood,
Yeah.
decreases to levels so low that is considered like undetectable, and which means that can't be passed on to people. So now people that are on treatment, they can have kids, women can breastfeed, you can have condomless sex and you don't pass on the virus. So it's really like from where we were in the 80s to now, it's like has changed completely.
Yeah, I think like what they call it now is
Undetectable. Yeah.
untransmittable, undertransmissible, U equal U.
Yeah.
I never heard about the injection anymore. Is like available for anyone to use it.
Yeah. With the changes that we mentioned before, now anyone who lives here can get access to the injections. There are a few considerations that you have to have if you're a migrant, especially if you're considering going back to your country. But injections are like a great, great story. Yeah.
Yeah. So we'll go back to your work as a peer
Mm.
navigator, working with the Spanish community in this HR in this area. What is the one of the main things that your clients face? What are the main problems that your clients face at the moment?
Yeah, there are a lot of intersectionality in the work I do because HIV is not something that ruins your life, but makes it more difficult. So being a migrant already brings a lot of challenges. So being HIV positive just make it more complicated. It does affect the visa situation. If you want to
Mm-hmm.
apply to a permanent residency,
Yeah.
HIV is a factor that might affect you. There are other things like the social stigma, disclosing to people, sometimes at work. We have come a long way. A lot of things have improved, but
Yeah.
there's still things, a lot of challenges. But specifically to my community, the migrants that live with HIV, I would say is the home affairs system.
The Home Affairs system. Like before we go in depth in this area, I also know that you were part of Latin American Positive Network.
Yeah.
Tell me more about this group.
When I was volunteering, there was this program led by NABWA, which is the National Association of People Living with HIV in Australia.
Mm-hmm.
They wanted to create communities to advocate for themselves,
Yeah.
and they realized that there was this big group of Spanish speakers. So I got involved into that, and that led to create PLAN, which stands for Positive Latinx in Australian network,
Mm-hmm.
and is Latinx positive people that we are advocating are working for our community.
Yeah.
So this is on a national level. So a lot of us were lucky enough to land in positions in organizations. So now we're all working and we have this network where we try to optimize our resources and like try to help more people.
The main obstacle generally is when I apply for PR,
Mm.
is that HIV is considered as a chronic disease, and so what should be done to fix that?
The thing is that at the moment when you apply to a visa, if it's permanent or temporary, there's a lot of requirements. And on the health requirements, chronic disease can affect the decision, because that means that there's an extra cost for the country for you.
Yeah.
And it's all based in what you bring to the country and why you deserve the visa. So like bringing that luggage, it has a negative impact at the moment. But the thing is, with the new laws, now Australia is paying for everyone's medication. So it's not going to have an impact in the future if you become a resident or not, because that's a cost. It's like a
Exactly.
sink
So the
cost.
whole point is it costly
Yeah.
on the government, but now the cost is already being paid.
Yeah.
So, but the law hasn't changed yet.
Yeah, and the thing is, because people have been applying, we've been here forever. No, since the 80s. But because we've been here for so long trying to stay, and for a lot of people that HIV diagnosed means that they can't go back to their countries because they don't have access to medication, because they're going to be like isolated, and it really changed their life and they need to stay. And it's a very challenging system, sometimes expensive, and you know all the challenges that international students have. And despite all that, people have found the ways to become residents. It's a very long process,
Yeah.
but they do it.
Yeah.
And there are lawyers that are expert in this, and eventually everyone gets to the residency. And it makes no sense that we put people in this stress. We make them spend money that they don't have, just because. I think it's just because.
From the work I do as well in HIV area, I'll always listen that the numbers are always going low, but the numbers aren't going lower in the multicultural community. And I know like both of us worked on the translating the facts in Living Positive Victoria, and just having all different tools and information translated to different languages. You worked on the Spanish part, I worked on the Arabic part, but like, tell me more about this and like, how do you think it'll affect the community?
I think like projects like this are very important because it tells us that we are seen, that they understand we're there and we have different needs. And Living Positive Victoria had these facts, like relevant information for people that have been diagnosed. And they were translated into the different languages, and even the research that it was made to know what languages, shown that there are like need. I think we use like 9 different languages, but there's need for more languages.
Yeah.
But it's so expensive, and it takes so long like to take all this information and like changing. But it's so, I don't know, like it feels a little bit more like home when you can read something in your language and you understand it, and it's not stigmatizing. It's incredible, like the impact that have.
Totally agree with you. Like just reading things in your own language, and it's also each language has a different way of saying different things. So it's very hard to translate all this information and make it make sense to different languages. I think like focusing on the multicultural community and listening to them and listening to what they want to say and how they want the work be done in their area is already like a great start.
Yeah, because things are changing. Now with the introduction of PrEP, which is a medication that people can take for stop getting HIV, has changed the demographic. Less Australian-born people are getting diagnosed, less gay people are getting diagnosed, and in proportion, numbers are changing, and more straight people are getting diagnosed. People born overseas are getting more diagnosed in proportion.
Yeah.
Numbers are decreasing, but if we want to get at some point stop transmissions, we need to fight all sides.
Yeah.
And for that, we need to be able to engage with people. I work in Living Positive Victoria, and part of the multicultural working group, we now got some funding to create a multicultural engagement strategy plan.
Yeah.
Which means that now we're going to work with communities that we have no engagement and listen to them, get their needs, and we're going to implement that into our operations.
Yeah.
So we can engage with more people, so we can help more people.
That's really good. Like, it's good to listen to the people who need the work done to them and work according to them. So I work with the community, and the community has lots of trauma within, and dealing with all these as a peer navigator and meeting lots of clients, it must affect you personally. So what are the things that you do to take care of yourself, to be able to take care of the community?
When I started working as peer nav, I have no formal training, and this is not something that you can study. I've gotten a lot of different trainings, which make me more aware of my mental health, how I communicate, little things here and there. But something that I really like, it works for me, and I'm very happy where I work because they provide me this, is supervision. Like I have a clinical supervisor, I have my own supervisor, we meet weekly, I have my own therapist, we have all these peer navs meetings where we all talk, because it takes a lot to put yourself out there. Like every time I talk with people, it's like repeating my story, and it could be triggering. You know, sometimes they're challenging things that I didn't know it could happen, and then I think this could happen to me. So it's a very hard work, and you put yourself, like your whole self, out there constantly. And sometimes you feel that you're not doing enough, or that what you're doing is not going to fix the issue. But sometimes, especially for migrants, feeling that you have someone there for you that's going to listen to you, it's very helpful, because we all need connections, and sometimes we don't have that.
Before you go on what you do personally, but also like what's the difference between clinical supervision and therapist, or like what's the difference between them?
So I have my personal therapist to deal with my own trauma, not to deal like with my my life.
Taking all this,
then I have my supervisor, which is like we talk like on an operational level how to do this, or the things that I'm planning to do.
Discussing the cases that you have.
Yeah.
Yeah.
And then I have my clinical supervisor, who is a counselor, and with them I talk about because another thing with HIV, everything is confidential, so it's just like I can't be like, this is what happened, and like everything has to be like situations and abstracts, and sometimes like I don't know how to deal with some stuff, so
everybody has a different story, and they're faced with different things. And
or sometimes you feel that you want to say something, but you don't know if it's what you have to do, or you feel that you did something wrong, so you get this validation of someone telling you did that because here, next time you can do it this way. So it's like this validation of this is how you do it, and with each conversation you get better at what you do.
You were gonna continue and say like how about like other things that you do to take care of yourself?
Yeah, I like to do sport. I think it's, for me, I ride my bike everywhere, and like feeling the breeze on my face and just listening to music. It always is a reset for me. It doesn't matter how bad the day was. Like that gives me like, I like this analogy of bikes, that in order to be able to work, you need to keep moving.
Yeah.
If you stop, like you fall.
Oh, that's good.
Yeah. So like for me, riding my bike is amazing. I do yoga. I, even though I live very far from home, I always calling my family. I try to meet my friends weekly, and I do things that I know are good for me.
Yeah.
Even though I don't want to do sometimes, like wake up and do exercise, I'm like, no, it's good because I know it works.
Like you're saying, like the air coming to your face just makes you relax and make you like refresh and start fresh for new things to work on. We were saying like one of the main complications is having the visa problem. Like what do you want to do about it?
When I started advocating, I didn't know I was advocating. I was just making questions like, why do we do this that way? Why don't we do it that way? It was just me trying to understand why things the way they were. And then I realized I was advocating, and I was like addressing issues, and as a migrant, I don't feel it's my place. No, it's hard sometimes to demand your rights.
Yeah.
And little by little, I've been like building this confidence, networking, and trying to, like, I understand more the limitations, the challenges. It's like a very complex situation.
Yeah.
But there are a lot of things that no one's doing. And I've noticed that I've been the one who's like, okay, why don't we do that? Or people that maybe tried it in the past, but now they're tired of the system, or they got stuck in other projects.
It's a lot of work to be doing, like legislations to be changed. It's a long process that takes lots of years, 5 years, 10 years.
Yeah. Like it has to be like a sustainable, like leadership.
You have to start somewhere as well.
Yeah. But now I see myself with like a very specific goal, which is getting rid of help to get rid of this restriction. That it costs a lot of money to the Home Affairs Department, with and it makes no sense that they're wasting all this money, but also like all this stress and also cost that brings to migrants, because the Australian migration system is very hard.
Yeah.
Like there's a lot of requirements, and you need to do a lot of things, and in the just specific cases you can get your visa. So if
It's a lot of
already
information that you have to always keep up with and learn the different changes that happen all the time. And
yeah.
it takes lots of work and lots of time. Having this removed will definitely help lots of the people living with HIV to easily migrate when they apply to different visas and not having an obstacle to them.
It's not gonna make it easier to migrate because it's already hard.
Yeah.
Like you need to study or have like a specific degree. It's already hard. Like it's not that Australia are giving visas away to everybody. It's just people that deserves them, or like people that are needed here.
Yeah.
If you can just make it fair for everyone, that's my goal. Like I don't see why it has to be more difficult, not just for people that lives with HIV, but any person that has like a chronic disease, because we don't choose to be sick.
As you were talking about like peer navigation and support that you give to their clients, do you want to tell me more about your day-to-day and how this actually works, and for people who don't understand what that means?
Yeah, that's a great question. So I'm on with a student visa now, so I can only work 3 days a week. So that's what I work. And so basically I have a lot of responsibilities, but I can like summarize it in two. One is give one-on-one support with people. And this is when someone gets diagnosed or they arrive to the country with HIV diagnosed, they reach to a Living Positive Victoria. There are more services around Australia, and there are different organizations in all states.
Yeah.
But here in Victoria, they reach us. And what I basically do is meet them frequently, and we talk about the challenges they face related to HIV.
Yeah.
And because I'm connected with the sector, I'll provide referrals sometimes if they need like some legal support. Sometimes they need money, housing, because there are a lot of issues. But it takes a while to build the trust. I have to share a lot of my stories so they can start relating. It's very interesting that most of people that live with HIV have the same fears: rejection, isolation, not being able to like find partners in the future, like all those kind of things. So you start, at least I have developed this knowledge of all the stories I've heard and be like, oh yeah, that's common. But you build that. And then my other part is I plan social events.
Yeah.
Because it's very important to know your community, and it's so much easier to talk with someone that knows what you're going through. Sometimes we have nothing in common, but it happens not just with people that live with HIV. Like when queer people meet queer people, is the same. When trans people meet trans people, like
Yeah.
even
Just
as
having community is definitely important.
even as migrants, I meet people from my country that we would not be friends in Chile, but here we are.
No, I understand that too.
Yeah, so creating those connections, it has to be in a way that I create a safe space so people can feel free to talk. And yeah, it's a lot of people don't want to go, they're scared. So there's a lot of work with different people and just like make them feel safe.
With the sound of it, work with so much clients and have so many cases. Tell me a story that you're most proud of.
In Chile, I was working as engineer in mines, and I questioned the purpose of having a job that has a negative impact, because I was thinking, oh, this is, like
affecting the environment.
Yeah. And I wanted to do something, and I have always volunteered for different causes. So when I started volunteering for my community, I was like, oh, this is it. Like, I love this. It's not me helping kids in foster houses. It's not me people like helping homeless people. It's me helping people who have the same virus.
Yeah.
And that was very fulfilling. I didn't think I could work at that. I have a story. When I first got diagnosed, I was part of this study. They interviewed me, and there was a lot of quotes. And now that I'm working with the person that is doing this study, he asked me to review like
the questions
Yeah.
that you answered in the
So I
first, like,
yeah, so I could read what I said 4 years ago when I was recently diagnosed, and there's this part that I said, "Oh, I love the work that my peer navigator does. I wish I could do something similar in the future."
and now you became a peer navigator.
Yeah, and I was like, that is awesome because this person inspired me to help and find a way, and this is a successful story. Like now that I've been like working with my community and showing that it's possible to find places as migrants in this type of jobs, like a lot of people are willing to help. There's like this community that is growing, they're engaging, they care, and whenever I get like appreciation words or be like gratitude, I'm like it's like that it's I can't explain it. It's like it gives meaning to my everyday.
Yeah.
And I feel very lucky that I get to work in something that gives me so much joy.
You also mentioned that you work in the Positive Bureau for Public Speakers as Positive. Like, which organizations ask for people to talk about that? And tell me, like, one of the times that you like really like had an experience that touched the audience that you're talking about.
Yeah, so Living Positive Victoria has a program that is called the Positive Speaker Bureau.
Yeah.
That are HIV positive people that go to different places and talk about their experience living with HIV, the challenges, the things that they have lived. And I have the privilege to go to many different places. I've gone to schools. I've gone to Thorn Harbor, the volunteers induction, I think it is.
Yes.
I have done a lot of things in like campaigns, like Wear It Purple Day or like World's Memorial. There's like all these events, and I've been able to bring the migrant flag and be like, these are our challenges. This is like the difference. It's interesting how my experience, which is unique in a way, but so many people can reflect on that. So many times after a talk, someone comes to me and be like, like this specific thing that I said, like it really resonated to them. And I like how I connect with people because we kind of face similar challenges.
Yeah.
But yeah, like anyone who's interested in having a speaker can contact Living Positive Victoria. And they can do sex education. You can get like 1, 2, 3 speakers. It depends on the needs. But it's good to have that.
What's one thing that you would like want to tell people about your journey and advice generally about people living with HIV?
None of us thinks that we can get HIV, and it's very likely that a lot of you won't. But it's very likely that you're gonna meet someone that lives with HIV. And I think it's good that you educate yourself so you can be a person that makes the right questions when someone tells you and not the wrong questions.
Yeah, it's always nice to be kind. You never know what the next person next to you is facing or what the life has given to them. So be kind is a great message. Thank you for coming. Thank you for watching. My name is Abdurrahman Kotomish, and this is Grit on Grace on Ben TV.